Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good day, everyone. Today, listen carefully and do something practical with what you hear. Look at the plate in front of you and ask, why does one piece of fish have the power to influence pressure inside the arteries? How can something so ordinary at dinner become part of a serious strategy against hypertension? Hypertension is not simply high numbers. Think of it as persistent force against the blood vessel wall. That force quietly strains the heart, stiffens arteries, burdens the kidneys, and increases the risk of stroke and heart attack. So do not treat blood pressure as a number that lives only in a clinic. Treat it as a daily biological conversation between your blood vessels, your kidneys, your nervous system, your hormones, your salt intake, your weight, your sleep, your activity, and yes, your food. Now focus on fish meat. Do not think of it as only protein. Think of it as a package. High quality amino acids, omega-3 fatty acids such as EPA and DHA, minerals, and in some fish, small protein fragments that may interact with blood pressure pathways. The American Heart Association recommends a dietary pattern that includes at least 2 servings of fish per week, particularly because fish and seafood intake is consistently associated with better cardiovascular outcomes. But ask the essential question, why fish, specifically when many foods contain protein? How does fish meat reach the artery? How does it speak to inflammation, vascular tone, sodium balance, and the heart's workload? Let us move step by step. First, understand this. Hypertension often thrives in a food environment built from salt, processed meats, refined carbohydrates, and saturated fat. So begin with replacement. Put fish where processed meats used to be. Replace bacon, sausage, salty deli meat, fried chicken, and heavy red meat meals with grilled salmon, baked trout, sardines, herring, cod, or tuna chosen wisely. Why? Because blood pressure does not respond only to what you add, it responds powerfully to what you remove. The DASH eating pattern, Dietary Approaches to Stop Hypertension, was designed specifically to lower blood pressure. It emphasizes fruits, vegetables, whole grains, low-fat dairy, nuts, beans, poultry, and fish, while reducing sodium, sweets, sugary drinks, and excess saturated fat. The National Heart, Lung, and Blood Institute describes DASH as a flexible, balanced eating plan for heart health, and fish is part of that pattern. Now ask, how strong is this dietary approach? In the DASH sodium trial, combining a DASH-style diet with lower sodium produced major blood pressure reductions. Compared with a controlled diet high in sodium, DASH with low sodium lowered systolic blood pressure by about 7.1 mmHg in participants without hypertension and 11.5 mmHg in participants with hypertension. That is not a decorative change. In population medicine, even a few millimeters of mercury can shift risk. A drop near 10 points can be clinically meaningful. So do this. Make fish part of a DASH-style plate. Do not eat fish beside salty fries and call it therapy. Put it beside vegetables, beans, lentils, brown rice, sweet potato, salad, fruit, and unsalted nuts. How should the plate look? Half vegetables, 1/4 fish, 1/4 high-fiber carbohydrate with olive oil, herbs, lemon, garlic, pepper, and minimal salt. Build the whole environment around the fish, because fish works best when the rest of the plate stops fighting against it. Second, consider omega-3 fatty acids. Fatty fish, such as salmon, sardines, trout, anchovies, and herring, contains EPA and DHA. These fats enter cell membranes. Why does that matter? Because the artery is not a stiff pipe, it is living tissue. Its inner lining, the endothelium, helps decide whether vessels relax or constrict. Omega-3 fats may support endothelial function, influence nitric oxide pathways, reduce inflammatory signaling, improve triglycerides, and modulate vascular resistance. In simpler words, they may help the artery become less tense. Now ask, how much omega-3 is relevant for blood pressure? The 2022 dose-response meta-analysis in the Journal of the American Heart Association reviewed 71 randomized clinical trials and found that about 3 grams per day of combined EPA and DHA was associated with the greatest blood pressure lowering in the analysis, with benefits seen from food or supplementation. The American Heart Association's scientific communication on that review also emphasized that roughly 3 grams daily appeared to be an optimal dose for lowering blood pressure, while noting that more research is needed and that trial methods varied. But pause. Do not misunderstand this. A normal serving of fish may not deliver 3 grams of EPA and DHA every day. Some fish are rich, others are lean. Salmon and sardines provide far more omega-3 than cod or tilapia. So what should you do? Eat fatty fish regularly and use lean fish as a healthy protein replacement. Do not turn fish into a magic pill. Use it as a repeated dietary signal, delivered week after week. Third, look at the hidden blood pressure pathway, the renin-angiotensin system. Why do doctors prescribe ACE inhibitors? Because angiotensin-converting enzyme helps generate angiotensin II, a molecule that narrows blood vessels and encourages salt water retention. Now here is the quiet detail many people never hear at the dinner table. During digestion and processing, fish proteins can release bioactive peptides, and some of these peptides have shown ACE inhibitory activity in laboratory, animal, and limited human research. Reviews of marine-derived peptides describe fish protein fragments that may influence ACE activity and blood pressure biology. How should you interpret that? Carefully. Do not say, fish replaces my ACE inhibitor medication. Do not do that. If you take blood pressure medicine, continue it unless your clinician changes it. But understand the direction of the evidence. Fish meat is not merely low-fat meat. It may contain protein structures that, once broken down, interact with the same broad pressure control system targeted by some medications, although food effects are gentler and less predictable. So give your body the chance to use that chemistry. Choose real fish fillets more often than highly processed fish products. Bake it, steam it, grill it, poach it. Use lemon, dill, parsley, paprika, turmeric, black pepper, garlic, onion, chili, ginger, and vinegar. Avoid turning fish into a sodium bomb. Why? Because smoked fish, salted fish, fish sauce, heavily seasoned canned fish, and fast food fried fish can push sodium so high that the blood pressure benefit is weakened or erased. Fourth, pay attention to minerals and amino acids. Fish contributes high-quality protein that supports muscle mass and satiety. Why does satiety matter? Because weight gain and insulin resistance often travel with hypertension. When a meal keeps you full without excessive calories, it helps reduce the pressure load over time. Some fish and seafood also provide nutrients such as selenium, iodine, vitamin D, and taurine. Taurine, an aminosulfonic acid found in seafood, has been studied for cardiometabolic effects. Recent meta-analytic work on randomized trials has reported reductions in systolic and diastolic blood pressure with taurine supplementation, though this should be interpreted as supportive biology rather than a reason to self-prescribe high-dose supplements. Ask yourself, how can a meal lower blood pressure if it only acts in one way? It usually cannot. The power of fish is that it acts through several small doors at once. Better fat quality, better protein quality, less saturated fat when replacing red meat, less sodium when replacing processed meat, omega-3 effects on vascular tone, possible peptide effects on ACE activity, and improved meal satisfaction. One door may be modest. Several doors, opened repeatedly, can matter. Now make this practical. Start with 2 fish meals per week. If you already enjoy fish, move toward 3. Choose fatty fish at least once or twice weekly. Use a portion about the size of your palm, roughly 3 to 4 ounces cooked for many adults. If you are larger, very active, or have different protein needs, adjust with professional guidance. Choose salmon, sardines, trout, anchovies, herring, or light tuna more often. Use cod, pollock, haddock, or tilapia as lean alternatives. If using canned fish, choose low sodium or no salt added versions when possible. Drain it, rinse it if needed, add your own flavor. Ask, how should breakfast, lunch, and dinner change? Try sardines on whole grain toast with tomato and avocado. Try salmon with lentils and spinach. Try trout with roasted vegetables. Try tuna with white beans, cucumber, olive oil, lemon, and herbs. Try cod in a tomato garlic stew instead of a creamy sauce. Keep it simple enough that you can repeat it. And please avoid the common trap. Do not deep fry the fish. Why? Frying adds refined starch, oxidized fats, and often salt. The fish remains fish, but the meal becomes a different cardiovascular message. If the goal is blood pressure control, cook in ways that preserve the benefit. Now let us discuss safety. Fish is beneficial, but selection matters. Mercury is the main concern with certain large predatory fish. The FDA and EPA advise eating fish while choosing lower mercury options. Their guidance recommends 2 to 3 servings per week from best choices for groups such as pregnant people, breastfeeding people, and children, and it uses portion guidance to balance benefits with mercury exposure. So do this. Favor lower mercury fish and limit high mercury fish such as shark, swordfish, king mackerel, big-eye tuna, marlin, orange roughy, and tilefish. If you eat locally caught fish, check local advisories. Now ask, who should be especially thoughtful? People with kidney disease should talk with their clinician about protein, potassium, and phosphorus needs. People on blood thinners should ask about major changes in omega-3 intake, especially if supplements are involved. People with fish allergy must avoid fish and use other heart-healthy strategies. Pregnant people should choose low-mercury fish and follow FDA/EPA guidance. And everyone with diagnosed hypertension should monitor blood pressure at home, bring readings to appointments, and avoid stopping medication because of a diet change. Here is the key instruction. Measure the effect. Do not guess. Use a validated upper arm blood pressure monitor. Sit quietly for 5 minutes. Keep feet flat. Support your arm. Take 2 readings 1 minute apart. Record morning and evening readings for a week before changing your diet. Then continue after adding fish-based meals and reducing sodium. Why? Because your arteries give feedback. Let the numbers teach you. Also, be patient but not passive. Food changes can influence blood pressure within weeks, especially when sodium is reduced, but long-term benefit depends on repetition. Do not eat fish once and ask, did it work? Ask instead, how will my arteries respond after 12 weeks of better meals, lower sodium, more movement, better sleep, and consistent medication if prescribed? That is the mature question. So remember this. Fish meat can help hypertension not because it is magical, but because it is biologically well designed for the cardiovascular system when chosen and prepared correctly. It can replace harmful foods, it can deliver EPA and DHA, it can support a DASH-style pattern. It may provide peptides and nutrients that touch blood pressure pathways in quiet, layered ways, and it can make healthy eating sustainable because it is flavorful, versatile, and satisfying. Do this starting this week. Choose 2 fish meals, keep them low in salt, cook them cleanly, pair them with vegetables and whole foods, and track your blood pressure. Ask yourself every time you prepare the meal, why am I eating this? How is this helping my vessels relax, my heart work less, and my future become safer? Let the answer guide the habit. Thank you for being here with me today. Take care of your heart, take care of your table, and take care of one another like family. I'll see you in the next topic.